Hello, everyone, and welcome to episode 1 of our 6-part mini-series joining Florida and Georgia Republican Senate candidates. Today, we're going to dive into COVID-19 with our candidates, Megan Rocha from Georgia, Anthony Lindo from Florida, and we have Sanjana Krishnan, Miss Rocha's campaign manager, and Fayo Akinsamni, Mr. Lindo's campaign manager. So take it away.
Thank you, Megna, for having us. So, cloth masks or medical grade masks?
I would definitely say medical grade masks. They're much more protective than cloth masks.
Okay. I would say cloth masks because they're more comfortable, but What about you, Khalil?
I would rather be more safe than comfortable, so I'm going to go with medical grade mask.
That's good. All right. So, fever or runny nose?
I think runny nose because fever is really extreme in some cases, so definitely runny nose.
True.
For me, it just depends on the type of fever. Because if I'm going out and I have a runny nose while taking a picture, I'm going to go with fever instead. But if the fever is very severe to the point where I have a high temperature and I need to go to bed, then definitely runny nose.
Yeah, I would take runny nose because if I sneeze next to somebody, they're just gonna start running. All right. So, which year do you think is better, March 2020 or March 2021?
March 2021, just because we have less COVID cases. Now we have vaccines, so much better than March 2020.
Okay.
Definitely March 21, mostly because 2020 was just the worst year, especially since March marked the start of basically on how COVID spread, and that's when we had to start closing schools. Well, March 2021, COVID rates are going down, and everything is good for March 2021.
That's good.
Thank you, Fayo. Now we're going to move on to the actual questions about COVID-19. The first question is, what is your opinion about the CDC and their mask mandate? And how do you feel about Texas going maskless? Megan?
I definitely think that CDC implemented the necessary guidelines our American people need to quicken our recovery from this pandemic. In regards to Governor Abbott and his decision to lift the mandate, I don't believe it's the wisest decision he could have made. Even though on March 29th, all adults in Texas will receive the vaccine, we can't assume that this is going to solve our struggles with this pandemic. Regardless of the decrease in hospitalizations and the increase in vaccinations, cases of COVID-19 can still continue in the state.
And what about you, Anthony? What do you think?
I actually believe that the CDC should leave their mask decisions to the states, as different states will have different COVID rates. And because of this, the CDC trying to act as a federal government and forcing states to wear a mask mandate, even though certain states' COVID rates might be going down, is absolutely absurd to me. And for Texas's decision going completely maskless, I think it's completely fine. Texas's COVID and hospitalization rates are going down and are continuing to going down as people are taking more vaccines. And if the state government believes that going maskless is the right thing to do, then me as the running candidate for Florida, I have nothing to judge the state governor of Texas.
Okay, moving on to the next question. How do you believe you will be able to integrate certain policies to help distribute vaccines and the recovery process of your respective states?
I intend to work with the Georgia Department of Public Health to better communicate with the CDC and ensure that we have availability of the vaccines to those who meet the criteria. I also intend to increase testing availability at local drug and grocery stores, and not only work with Georgia officials, but also government officials to ensure greater distribution and access to these vaccines.
And what about you?
My policy will specifically focus on setting up more availability for Floridians to take vaccines, as making the vaccines is also very important, but we need Floridians to get access to the vaccines. So I will be working with many districts in Florida to set up more buildings for vaccines for availability.
And the final question. What are your thoughts on the politicization of COVID-19?
I believe that we should rely on science to proceed with this national health emergency. In our government and in Congress, unfortunately, both parties are split on the policies that we should be implementing. So I intend to promote bipartisan cooperation to form the policies that would benefit the American people and the country.
I agree with Megan on this case. I believe that the politicization of COVID-19 is absolutely absurd, and the fact that party lines are split between their policies on COVID-19 is ridiculous. This is a pandemic, and the virus does not care which party you're on, and we need to believe in science in order to overcome this pandemic. So making COVID-19 a political issue does not help Americans, and it certainly doesn't help the citizens of Florida.
Thank you for joining us for today's episode, our inaugural COVID-19 episode on where we stand with Florida and Georgia. Tomorrow, be sure to tune in where we dive right into healthcare. Thank you.